I think that patient-doctor relationships today are complicated, and I think it's important that patients feel empowered and not intimidated to question and ask questions and to have a partnership in their own health care with their medical providers. I have a mother who was always that way. She had a wonderful relationship with our pediatrician. I have a brother, and she was a medical person herself. But I remember that not only was she not afraid to ask questions of our pediatrician, but she also was not afraid to question the pediatrician. And I think that's very important. So if I've been at a doctor's appointment and I've felt rushed and I didn't have the opportunity to ask all of my questions, what I find helpful is that I will call his or her secretary. Say that we just ran out of time. I have these 2 questions. When Dr. So-and-so has a moment, would you please ask these 2 questions for me and get back to me so I can have the information? And I've done that. And if it's a medication question, sometimes what I will do is I will call the pharmacist, because I think the pharmacists have a lot of good information about medicine. And what I'll do is I'll sit down and think of all the questions I need to ask in order to make myself feel comfortable, because I know myself as an individual. And I'll go back and I'll second guess and I'll say, oh my God, why didn't I ask about this, or why didn't I ask about that? I needed to have a procedure that everybody needs to have at a certain point in their lives. So I called the secretary 2 days before I went in, and I asked very specific questions about the procedure, the preparation before the procedure. The secretary was wonderful. She answered all the questions, and I just felt, at that point I felt that, okay, they're doing the right thing and I'm going to be safe during this procedure. I want to go in centered and grounded and empowered and feeling like I'm coming in here to talk to somebody who is working with me to keep me healthy.